So this is a quick one, 9 or so slides on other endocrinology type issues. We've talked about diabetes and we've talked about thyroid. Here's a little potpourri of a few other things. So adrenal gland issues. The biggest thing that we learn about for adrenal gland is what steroids do. And so steroids are the equivalent of what's produced in the adrenal glands, in the adrenal cortex, the corticosteroids, which are usually produced to decrease inflammation. Now, there are other steroids that are produced, the so-called mineralocorticoids, which are also involved in fluid balance. So aldosterone is the name, sodium retention is the game. And so lots of times people with issues of corticosteroids will also have issues related to the mineralocorticoids. So in Cushing's disease, they have too much cortisol. This will raise their sodium. Aldosterone's the name, sodium retention is the game, and also deplete their potassium. Conversely, in people with Addison's disease, they don't have enough cortisol, and they actually will deplete their sodium and raise their potassium levels. Addison's disease is best known by President John F. Kennedy. He had the classic signs. He had the striae. He had the sort of persistent tan. But he was adequately controlled with medication. So in people with Cushing's, it is very challenging to diagnose. If you got somebody that has that, redistribution of fat, the central distribution, the almost like Pickwick type appearance, although Pickwick syndrome is something different. But they'll develop these issues. They may have the electrolyte changes in which you have the low potassium and the higher sodium. The problem is that getting just a fasting or a random serum cortisol often doesn't diagnose it for you. You actually have to do something called the dexamethasone suppression test. To do this dexamethasone suppression test, the traditional thing is give 1 milligram of dexamethasone at 11 o'clock and then draw a dexamethasone or draw a cortisol level in the morning. If it's greater than 5, it's positive, and if it's positive, that's a sign of Cushing's syndrome. Once you've diagnosed it, then there is some treatment options. One of the treatments is to give something that actually blocks those corticosteroids. Usually you're going to need an endocrinologist to help you with this. There's some of the other things that do seem to have a little bit of blockade of corticosteroids as well, although we don't really necessarily always use them for that. It's a good idea to keep that in mind that they will. Most people with Cushing's will usually end up with surgery, and it is something that the endocrinologist will usually manage. Addison's, as we say, hypertension, high potassium, pigment, tan in places where you shouldn't get a tan when you're not, in a tanning booth naked. Their serum cortisol usually will be low. It usually is low enough on just a regular test. Those people would need to be put on steroids. Almost always you're going to need a consult. Dexamethasone is a good choice because it does cross the blood-brain barrier. So there's several different choices. Fludrocortisone can be used to treat Addison's. I mention it predominantly because it's also used to treat orthostatic hypotension, which is an off-label use. But I would encourage you, if you're interested, to do a little bit more reading about this. Acromegaly is an unusual condition in which the growth hormone is too high. There's various medicines that can be used that'll decrease that effect. I'm not going to talk a lot about these, but it is important to remember that some of these medicines can block growth hormone, and therefore you would not use them in children without really understanding that pharmacology. Growth delay, you can give supplemental growth hormone. There's very specific guidelines. Those do seem to change over time. Lots of times a pediatric endocrinologist is involved if you've got those growth delays. I don't usually start growth hormone myself, but I have had a couple of patients that have been on it. Diabetes insipidus, very rare. These people are peeing 40 to 50 liters a day. They're drinking 40 to 50 liters a day. It's very unusual. Now, the desmopressin that is used to treat DI is also used for enuresis for kids that have bedwetting. We used to use a nasal spray. They noticed the nasal spray had a lot more side effects. So we usually just use an oral version. I think it comes in 0.2 milligram tablets. And you can give 1, 2, or 3 of those at bedtime. You only need to really use it on the nights that you really need the effect. So sometimes these kids just do it when they're going on a sleepover or having some other reason that an accident would be a much bigger deal. But it is pretty effective in decreasing and eliminating the accidents. Lots of times we'll leave kids on it for a year or so, and then at that point their systems have matured enough that they no longer need it. So that was a quick tour. Concludes our 3-hour tour.